morning, all of you. Today I am with two cases. One is the case of Candidiasis, another is Tinea versicolor, T versicolor. I have to think about Tinea versicolor. There are several Teneas like Tinea capitis, Tinea faciae, Tinea corporis, Tinea crurae, Tinea pedis, Tinea manum, and onychomycosis. Whatever may be, despite of all these Teneas, this Tinea versicolor is caused by yeast, not by dermatophytes. Anyway, first of all, I am going to the case of Candida albicans, Candidiasis. Candidiasis is caused by Candida albicans. You know about Candida albicans? Candida albicans is naturally present in your mouth and GIT as a common cell, also in your vagina. Mouth, GIT, vagina, common cell. But when it becomes pathogenic when our body's immune defense get lowered. When there is immunocompromised situation, our immune failure will result in Candida albicans infection. Candida albicans act as a pathogen. Now, when the immunity gets lowered, you may have doubt in that. During old age or during infancy, there will be immunosuppression. Someone taking with the steroids will be immunosuppressed. From diabetes mellitus to HIV, there is immunosuppression. Then more than that, pregnancy is a stage of immunosuppression. Obesity also given a stage of immunosuppression. Now, I want to tell you what is the complaint by which patient in front of you with the Candida albicans infection. It will be itching, as just like all fungal infection, there will be itching and redness. Thus, in the patient case, by physical examination, you understand that it is erythematous plaque with a maceration. Erythematous plaque with a maceration. Okay. Now, where does this infection takes place? As you know, fungal infection is a warm, humid condition is favorable for fungal infection. Any area just like your axilla, there is warmth more than sweating because this humidity. So what happens is that in your axilla, groin, inframammary fold or abdominal fold, every warm, humid places is the favorable site of this fungal infection. Among candidial infection, I want to say two types of condition. One is paranechial infection, that is infecting our cuticles. The nails, the part above the nails is known as cuticle. There is a swelling of cuticle along with pain. On examination, you can see swelling, pain, and erythema, just like our candidial infection. It is not only due to this fungal infection, bacterial plus fungal infection is the reason for paranechial infection in chronic cases. But in acute cases, it is only a bacterial infection. Now, you may know about other condition that this candidial infection also causes angular cheilitis at the angle of mouth. There is redness and pain at the angle of mouth. It's again bacterial plus fungal infection. Say for example, candidial plus staph aureus infection. Now we are going to the lab diagnosis of these conditions. The lab diagnosis of this candidial infection mainly focused on culture or KOH scraping. Actually, we scrap the lesion and do a KOH examination. We can see the spores and pseudohyphae. Remember, it's pseudohyphae, not the real hyphae, because it belongs to yeast. After this KOH examination, you can also use, even in culture, the bacterial medium itself is a culture medium for Candida, but more precisely, we can say Severus dextrose agar is the culture medium for Candida albicans. Now, the differential diagnosis of this Candida albicans infections include dermatophyte infection, then dermatitis and psoriasis. How will you manage this condition? The management of this condition is actually, we will make the area dry, free from moisture, and we can use creams like topical imidazole or nystatin cream and powder like 2% miconazole in the folded area. Thank you for watching me. Thank you.